welcome to those of you who are just joining us. We're going to give folks a few minutes to log on, so please just hang tight. Jushan, I'm not sure if you saw Megan's comment, but it looks like you're not able to see participants. Does that mean participants are not able to speak as well? Or can we turn them on to speak if they want to?
I think we'll turn them on to speak,
okay,
if they want to, but right now we're at 122 people. So
okay.
It's a regular webinar, but we can promote people to talk.
Okay, that sounds great.
And you may mention that
I'll let you explain how we're going to do the Q&A and that kind of stuff.
Okay, perfect.
Yeah. Okay. For those of you who are just joining us, welcome. I think we're going to go ahead and get started because we're about 3 minutes in. I wanted to start by explaining what this gathering is, and then with the land acknowledgement. So this webinar is for staff at the School of Public Health at the University of Washington. And we had received a bunch of questions from folks about sort of the status of return to work in person. And there's been a number of different changes, both at the state level and the university level in terms of policies. I wanted to make sure to go through those and then have a time to address concerns and questions that people had raised. And I invited Jashana to come and moderate again, because she did such a fantastic job of moderating the last time that we had a discussion with staff around COVID issues. And Jashana, do you want to take a minute to explain how we're using Q&A and questions and the Google Doc and all that?
Absolutely. Thank you, Hillary. Good morning, everybody. Yes, as with all the webinars that we have hosted in the past, we'll use the Q&A function if you want to type in your question that will, during the Q&A portion, we'll turn to those as well as to those that you have posed in the Google Doc. Additionally, if you'd like to actually raise your hand and we can unmute you and you can ask your question directly. While Hillary will be our primary panelist, we've also invited a couple of the other leaders from the Office of the Dean to be available so that she can punt some questions over to them. So we'll have, and they'll introduce themselves later, but we have Janet Baseman, Uli Haller, and Megan Herman who have joined as well. Thanks, Hillary.
Yeah, thank you, Jashana. I appreciate you taking on this role. So I put the link to the Google Doc in the chat function, just in case people want to have it handy. As a reminder, if you want to view it or add comments anonymously, you will need to log out of Google on Chrome or whatever browser you're using, and then open up the link again, and that will log you on anonymously. So with that, I would like to start with a land acknowledgement, and really to center ourselves on the place that we're in, and then we will move forward in terms of the more about the time that we are in. We within the School of Public Health, but broadly at the University of Washington, start our gatherings this way to acknowledge the longstanding history of where we are and what has shaped the context of the land we inhabit. Today, I'm using a land acknowledgement that was written by Tess Matsukawa, who's one of our fantastic staff in public health, global health, and her version is one that I particularly appreciate and am grateful for her sharing it with all of us. The University of Washington acknowledges the Coast Salish people of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, Suquamish, Tulalip, and Muckleshoot nations. Land that was stolen by European colonizers. Land that was stolen from the Duwamish, who are still here and continuing to honor and bring light to their ancestral heritage. This country was built on stolen land with the exploited labor of enslaved African peoples, as well as the exploited labor of underpaid Asian and Latinx peoples. These acts of colonialism, white supremacy, and anti-Blackness are the history of this country, as well as our ongoing and current reality. We want to honor and recognize the lives, knowledge, and labor of Black and Native peoples in the past, present, and future. There is an immense need for action within the School of Public Health and all other systems that is centered on liberation for Black and Indigenous peoples. This requires understanding the context of where we are, our own positionality within those systems, and a dedication to justice-based action. So with that, I'm going to turn it over to Ruki Hartman. So this was Jashana's suggestion, and it was a fantastic one. So just a word about Ruki. Many of you know Ruki from the fantastic anti-racism trainings that she and the rest of the EDI team have rolled out over the last year and a half. I have also had the pleasure of co-teaching with Ruki over the last year, a class that was for the Dean's Advisory Council of Students. And we started off by alternating each class session, either doing a deep breathing exercise that Ruki would lead, or by doing a check-in, a one-word check-in. And there was quick consensus amongst the group that that we preferred the Ruki-led breathing exercise. And in fact, one of the comments we got at the end of the class was that from a student, and I should say we loved this class. I mean, the students loved the class, we loved the class, they loved each other, being together. But one of the students said the highlight of the class, and in fact, pretty much their whole week each week, was the breathing exercise that Ruki led. So for me, the breathing exercise has become similar to the land acknowledgement of sort of a centering way to start convenings. And so Ruki, I'm really happy to have you here, and apologize if I misgendered your pronouns, which I am apt to do, but I'm still working on. So with that, Ruki, I turn it over to you.
Hi, good morning, everyone, and thank you, Hillary. I appreciate the little introduction. Yeah, as noted, breathing has been really central to the work that our equity, diversity, inclusion team does. We start all of our meetings breathing together. We often, during the trainings, when folks are in their breakouts, we breathe together to recenter ourselves. And it's been a really great reminder that breath work is central to healing work, it's central to anti-racism work, and it's central to the work that our school is doing through the affinity groups as well. So I wanted to lead us in some breathing this morning. So if everyone can kind of sit back and relax as best as you can. If you're sitting, feel your back against your chair, your feet on the floor, wiggle your toes if you want. We'll take a deep breath in through our nose and hold, and then we'll exhale through our mouth. So we'll inhale. Exhale. Notice any tension in your body as you inhale. Let your shoulders drop as you exhale. Inhale. Exhale. In class, I lead a mantra that's this: inhale worthiness. Exhale self-doubt. Inhale creativity and joy. Exhale judgment. Inhale courage. And exhale fear. As you inhale, you can stretch your neck. Exhale. Move your shoulders. As you inhale. Exhale. We thank you for being present today. We'll take one last inhale together. Inhale. And exhale. Come back when you're ready. I'll let Hillary take the lead.
Thank you, Ruki. That was fantastic. Every time you do this, I think I wish I could start every meeting that way. So glad you were here for this one. So here's our plan for today is I'm going to start with sort of a summary of where we are in terms of policies and with respect to return to work. Then I'm going to take some time to address generally some of the issues that we've been hearing so frequently from folks and to frame sort of where we are. And then Jishana is going to moderate more of a Q&A type style where we will come to some of the direct questions that are in the Google Doc. And as she said, you're also welcome to put stuff into the Q&A or to raise your hand. Okay, so starting with where we are, I want to start by saying that there's been a big change in terms of the vaccine mandate landscape across the state, which comes from the governor. So if you've been following the news, the governor announced that for state employees, and that was followed then by Public Health Seattle and by King County and city employees as well by our local governance, a mandate that individuals be vaccinated. And then he subsequently added to that mandate all individuals who are employed in so the original mandate included people who were employed in medical and healthcare industries. The later extension was extended to include everyone who's employed in K through 12 education, primary, pre-primary care, as well as higher education. So we are now covered under that mandate. That mandate explicitly states that individuals need to be fully vaccinated by October 18th. that the employers need to be collecting data on vaccine status for those individuals. It also eliminated the philosophical exemption that we had previously in the UW policy. So as of this point, the University of Washington no longer has a philosophical exemption. There still are exemptions for either medical or religious reasons, but individuals need to provide documentation for those. And I'm happy to answer questions about what that means to provide documentation. But hopefully at this point, all of you should have received messages about the need to attest to your vaccine status through Workday. And I'm going to call on Megan Herman to put in 2 links into the chat. One link, Megan, if you could, to the email that went out from me, I think it was the week before last, but it might have been before that, talking about return to work more broadly in person, return to work in person more broadly. And then specifically, if you could, Megan, put a link in the chat to specifically to the link to Workday and to the page that describes the process for attesting. I did ask Uli to pull data for our school, and as of yesterday, 73% of the members of our community who need to attest via Workday, which includes student workers who are in the Workday system, have attested. And of those 73% who have attested, 98.5% of those individuals have attested that they are vaccinated. Another part of the governor's mandate is that simply attesting that you're vaccinated is no longer adequate. The University of Washington is working hard with Washington DOH to set up a mechanism by which we can go into the Washington State Vaccine Registry to be able to check on vaccine status for people who are vaccinated in the state of Washington, so that people don't have to upload evidence of vaccine status, that we can do that through the state database. And so we are not anticipating that we're going to be asking you as individuals to provide more evidence, but rather that there will be checking done by EH&S. And if for some reason you're not in the Washington State Registry, but you have attested that you're vaccinated, at that point you would be contacted and asked to provide documentation. The other mandate that the governor released just recently was an indoor masking mandate. And we also have an indoor masking mandate on campus now for all persons. So that is regardless of your vaccine status, that you need to be wearing a mask when you're indoors. So you should have, if you've been on campus, you're probably seeing over the last couple of days, a switch over from the previous masking. If you happen to see that there are signs that refer to masking for individuals who are unvaccinated, please let, I would say, Uli know, or the building man, or better yet, the building manager for your building know, so that they can get those swapped out. And if you don't know who that person is, Uli's a good person to reach out to. So those are 2 really big changes that we have going on at the state and at the university level. One thing that has not changed is that the campus still is coming back to predominantly in-person work effective September 13th. And I saw some questions about why September 13th, and I myself asked that question many times. And the reason for the September 13th date is so that we have our employees, so the staff and faculty, transitioned back in before we start doing orientation and having students returning for fall quarter. So it gives us about a little over a week in terms of leeway before we start having significant number of students coming back into the residence halls and into showing up for orientation events. So, which is not a huge amount of time, but I think my sense is that that late of a date was selected by the president and provost way back when, so that families would have a chance to use this week and next week to, particularly those who have children who are returning to school themselves in person, who are in K through 12, to give families a chance to get their kids situated and to adapt to that new routine before they themselves moved back into in-person work. With that in-person work schedule, that is a university-wide policy. So individual schools, departments, or units within departments are not able to unilaterally make a decision to come back at a later date. It really is focused on trying to make sure that we have critical staff here available to support our students as they come back in person, because we are planning to be in person for instruction this fall. And then recognizing that with the return of support for students in person comes a lot of additional supports for people. That being said, the president and provost have provided a fair amount of flexibility to units to approve telework agreements. And I think that Megan included the link. It's probably that back to campus communication, where we detailed some guidance that was rough guidance for staff about telework expectations. The most important thing for you to know, besides that, that we are returning on September 13th, is that if you do not have assigned telework, either 100% telework or hybrid telework arrangement in place before September 13th, the default assumption is that you will be working 5 days per week in person. So if you have not done so already, if you wish to continue to work partially remotely or 100% remotely, you need to make sure that you have had that conversation with your supervisor and that you have submitted the appropriate documentation so that we can get those approvals in place before the 13th. So, like I said, if you haven't yet looked at that or somehow missed the messaging around that, please make sure that you refer to that document. For the most part, what we are seeing for those who have turned in their telework agreement so far is that most staff in our school are either doing what we refer to as a 2+3 arrangement or a 3+2 arrangement. So either teleworking 2 days a week and being in person 3 days a week, or teleworking 3 days a week and being in person 2 days a week. We understandably, those people who are doing work that is very focused on student services tend to be here more days in person. And many of those individuals are planning to do 4 days in person and 1 day remote. But we pushed, the leadership in the school had many conversations and came to the consensus that we would very strongly encourage supervisors to allow even those people who are doing student service oriented or things that really required being in person types of job tasks, to allow them the flexibility to at least have 1 day of telework per week by arranging schedules and staggering work schedules, so that they could take advantage of what we understand, and I appreciate myself, the advantages of the flexibility that we have all come to appreciate of being able to do some telework So while we are coming back to a predominantly in-person environment, this fall quarter is really a pilot period where we're doing a very hybrid model, and most of our folks will not be here for, certainly, I think my expectation, if people want to be here 5 days a week, we have some people who do not like working from home or do not have a good work setup at home. They are welcome to come in 5 days a week at this point, but we're anticipating that most people are going to be doing some sort of hybrid work schedule. I do also want to call out that that if you want to do 100% telework, that needs to be approved at the Office of the Dean level. And we're trying to reserve the 100% telework for truly exceptional circumstances. Those are detailed in the back to campus communication, as well as the process for putting in a request for that if you want to request that. Okay, so with that, Jashana or Uli or Megan, is there anything critical that you think that I have missed in terms of the summary of where we are before I sort of go on to the sort of philosophically, why are we coming back?
Nope.
I'm sorry, Megan, go ahead.
Oh, I was going to say, no, I don't think there's anything you need to add at this time.
Well, really quickly before you do the philosophical, one of the questions is in the chat about what really is required in-person activities. And I think if you could kind of early on tell people what that working definition is, that probably can help people relax and breathe a little easier.
Yeah, absolutely. I did also notice there was something that was actually not exactly correct, Megan, in terms of the vaccine attestation and workday due date. So, so the university certainly has asked, and like the university's policy, you are correct, is that people should have attested no later than September 10th. But when they start to come back in person, so for instance, like let's say your first day that you were back in person was the 14th, that you would need to have attested and prior to that date. I did want to emphasize the governor's deadline is October 18th. And the governor's deadline is a much more strict deadline. It's not that you should ignore the September 10th one, but the governor's deadline is the one where the governor refers to not being eligible for work if you have not attested and provided documentation by that date. So I guess I would just say the university very much wants people to have attested before they come back on campus. And that's our policy as a university, but there is this very significant date of October 18th as well. Okay, so yeah, so Jashana, thanks for bringing up the question sort of what is a required in-person activity. And I hear this from a lot of people in terms of that there are activities that that we were all doing remotely because we had no choice but to do them remotely for the last year and a half, and a sense that they were working well remotely. And so I think it's important to acknowledge that those modalities become less effective as we start to have students back on campus expecting to have in-person services. And also there are a set of responsibilities that, for instance, for folks who are doing IT support, where them being physically present back on campus is much more important as we start to have more people back in the office in person. So one of the questions that someone brought up was, for instance, advising remotely. And that's an example of something that I would agree we've had really good success with doing advising remotely over the last year and a half. And I think a strong sense from many of the folks, including myself, who work with students on a regular basis, that some students prefer that modality. So that was part of the argument that I made when I said that I thought that student affairs folks should be able to do one-day telework, was that it would make sense, for instance, that you could schedule specific office hours for remote advising, where students knew that you were accessible, they knew how to access, to get in touch with you, that you could do those on, for instance, the day or days that you are working from home. There are other types of responsibilities that student affairs folks have and deal with on a daily basis that are less well suited to doing remotely. I think the most obvious one of those is that we all deal with a certain amount of crisis management with students, and where they are really looking for someone to solve their problem in real time. And with students returning to campus in person, are going to expect that type of support to be provided by a real person who's on campus. And so that really is one of the primary drivers for instance, why I'm expecting that student affairs folks will be present on campus for more of their time, and why the people supervising student affairs folks who need to provide support for those student affairs staff and backup for them if they're dealing with crisis management also should be spending the majority of their days of the week on campus. So it really varies, and that is in large part why both the president and provost and myself have left it to individual supervisors and staff to have conversations about what the nature of their work is and what types of activities can be done remotely. But I just wanted to be clear that even if you were working effectively 100% remotely when all of us were remote, I don't anticipate that it's going to be that easy to be 100% remote, or that we will be effective once we get into this hybrid environment. So it's going to be, I think there will be challenges there that are de facto part of coming back together. And having some people present each day and some people remote each day. So I did want to talk about sort of broad brush strokes of like what, to me, one of the sort of unanswered or unspoken issues that I think is lingering in many people's minds is, why are we bothering to come back at all? And sort of subsets of those being, might it be better to just wait a couple of weeks or months? And then lingering behind those questions, that is it safe to come back? So first of all, talking about the why bother coming back at all? And excuse me, Megan, I don't know if you have, well, I guess I can put it in there. So if I did do a blog post on this last week, and so I'm putting the link in there. But what I heard from folks was that they would rather hear it from me in person as opposed to just read it, which I totally get. Why are we bothering to come back at all? So first, I want to acknowledge that the SPH community and the UW community as a whole have done a really amazing and inspirational job of dealing with the pandemic so far. It has not been easy for anybody. and it has been extremely difficult for many members of our community. When I look at what's happening at other institutions, and when I talk to my fellow deans at other schools of public health and other regions of the country, I am grateful every day that we live in a region where people understand and appreciate public health, where our elected officials work hand in hand with public health officials, that we have such fantastic public health colleagues, both at Public Health Seattle and King County and at Washington DOH. They're some of the best public health agencies in the country, if not the world. And also that we have university leadership at the highest levels that really makes decisions that they have a commitment and continue to have that commitment to align our policies and practices with the latest public health guidance, not just guidance from the CDC, but guidance from our local and state public health agencies, who are some of the most proactive of any of the public health agencies in the country about safety measures. So you may be asking, why are they thinking that we should come back in person? And it really comes down to that while people have done a great job under truly extenuating circumstances, that there are things that we are not able to do when we are all remote. And for me, seeing the amount of strain and stress and mental health issues that our community and communities across the world are struggling with, being in isolation is one of the primary motivators for coming back. We see this particularly in children and young adults. So there's very strong evidence to support that. I think all of us recognize that young adults, part of their development is growing independence and leaning upon each other more than their families. And they need to be back in an environment where they can be learning from each other, in addition to learning remotely from us. And that's particularly true for those students who come from low income backgrounds where they've been, I talk to students who are taking their classes from the dining room table with numerous family members in the background, and noises, and it's hard to study, and their families are strained economically. It is especially for our most marginalized and historically excluded members of our community that we need to come back in person and provide that sense of community. I also do very strongly feel that we can come back safely. So if I did not think we could come back safely, I would not support coming back, period. And I am monitoring the situation closely, as are our partners at Public Health Seattle and King County and the state, and at the senior leadership level at the UW. So the reason I believe that we are able to come back safely is because we have a high degree of vaccination within our surrounding community, but especially in our campus community, because of the strong vaccine mandate that we have, and because of the strong masking mandate that we have. So it is true that we are still in the midst of a surge of the Delta variant, and we do see an increased number of folks in the hospitals in our area, but the vast majority of those people are folks who are not vaccinated. And right now, Delta variant is predominantly a disease of individuals who are not vaccinated. There are exceptions to that, and we have very clearly called out for both staff, faculty, and or all three, faculty, staff, and students, that we are willing to make exceptions and special arrangements for individuals who are either themselves immunocompromised and not able to become fully vaccinated, or living with someone who's immunocompromised, or who have some other extenuating circumstance that makes it not possible for them to safely come back to work. I do want to make sure that people are aware that when I say safely come back to work, there are going to have to be very significant changes in terms of behavioral changes, in terms of masking. We will need to assume masking behaviors that are much more like, if not identical to, those that are used in the clinical environment, and where UW-Medicine has shown that they have been able to successfully, with use of those high level of vaccinations amongst their staff and faculty, and really rigorous masking adherence to the masking policy, that they are able to really limit, if not completely exclude, transmission in the workplace. And that is what we are aiming to do as well. So we are not aiming to, I saw someone ask, are you assuming that there's an acceptable level of transmission in the workplace? And I would say, no. I am asking all of you to become knowledgeable about, and we will help with that, what are the requirements in terms of masking and behaviors in order to keep everyone in our community safe, including yourselves. So it will require some changes in behavior, but I do think it is worth it in terms of the benefits that we will all accrue from coming back together in person. With respect to the why not just wait a couple weeks, that is informed by sort of I think a much more public health perspective on what we anticipate the pandemic is going to look like for the next couple of years. That hasn't really been reflected very accurately in the media. So pretty much uniformly, people who are working on infectious disease modeling and who and on specifically on the COVID pandemic have for at least a year been talking about the fact that we expect to see rolling outbreaks of new variants of COVID coming through the community, the global community. And that is because for the next couple of years. And that is because the vast majority of the world's population is not vaccinated. So we are living in a very privileged, isolated bubble here, where we have access to vaccines here in Washington state and good coverage. But while the majority of the world's population is not vaccinated, there will continue to be new variants evolving, and those new variants breaking out and spreading across the world's population. So far, we have seen that our vaccines that we have in the United States, which again, we're very privileged to have 3 fantastic vaccines, those vaccines provide really good coverage against severe disease and death against existing known variants. And the mRNA vaccines provide a really fast mechanism for developing boosters, either as the immunity to the vaccine start to wane, which you'll start to see coming out this fall as boosters for that reason, or because of new variants coming out that you'll expect to see boosters coming out probably on an annual basis to cover new variants, just like we have with new flu vaccines every year. So why is it that I say, therefore, I think we should come back now? While I do think we will see this current variant start to wane, I really do expect to see waxing and waning of variants and control measures coming and going over the next couple of years. And the thought of us remaining online for the next couple of years, to me, is completely untenable. It is just, while people have done an amazing job over the last year and a half, this life that we have had is not the life that I think our community wants or needs for the next couple of years. And so I am really want us as a community to figure out slowly over the next couple of months with this hybrid telework scheme, a way for us to be able to come back together in some measure in community with limited engagement with each other, with limited density, because we will probably only have about half the number of people at any given site on site, because people are doing these hybrid teleworks. But starting to rebuild that community that allows us to do the important work that we do within public health and as educators. So with that, I'm going to turn it over to Jashana to pick some questions that you want me to focus on, knowing that we have a limited amount of time left.
Thank you, Hillary. As I was going through the Google Doc, there's real concern about having unvaccinated people in the building and being around people and you don't know their vaccination status. People are not wearing masks, but there's no mask enforcement. Can you speak to that a little bit more about why we don't have people acting as mask police? Or
yeah. So first of all, I'm very pleased to see that we have within our SPH community such a high percentage of individuals vaccinated. It wouldn't surprise me if it drops a little bit once we get up to higher levels of attestation, because I'm guessing that people who are less likely to be vaccinated are more likely to procrastinate about doing the attestation, but I could be wrong. But at this point, I'm expecting that we will have 90% plus across both at school public health and across campus vaccinated. That's what we heard last spring in terms of people's intentions. And I think the vaccine mandate will help to drive that to completion. So it should be a relatively small percentage of folks who are unvaccinated. That is the reason that we need you to be wearing masks conscientiously and consistently, though. Is what we have learned in the last 6 months about the Delta variant is that it is possible for people who are vaccinated to contract the Delta variant and to transmit Delta variant. And so that is the reason why the governor imposed and why we at UW imposed a universal mask requirement or mask mandate indoors. Period, full stop, for regardless of whether you're vaccinated or not. So the combination of having high vaccine coverage and having really good compliance with masking, those two things in combination are what are going to give us that very, very low and hopefully no transmission in the workplace, similar to what we have seen in clinical environments.
okay, thank you. There seems to be a lot of angst around unvaccinated children who can't get vaccinated, those under 12, and parents who are being asked to choose between coming back into the workplace or their unvaccinated child at home. I don't know that there is a one size fits all answer to that question. I do know just from the fact that we have a lot of parents on the call, if you could offer some reassurance as to what the considerations are.
Yeah, absolutely. So, and I'm also seeing some chat in the chat about who's going to enforce the mask mandate. So I've heard from people in the community that they feel like they are uncomfortable telling other people that they should be masked. We will work on providing some guidance, not just for you guys, but also for students as well, about, so we're planning a all school wellness webinar that will be either during orientation week or the first, right as classes are starting, about expectations and also providing some guidance about how to intervene if people are not masked. So expect more on that, but it will be a community effort to help each other remember to remain masked, and we will provide some guidance for what to do if that strategy is not working. In terms of kids, so the American Academy of Pediatrics came out with a very strong statement of that they felt it was important for children to K through 12 kids to be back in schools, even though younger children are not able to be vaccinated, for many of the reasons that I articulated, which is that we're just seeing huge mental health challenges for kids who have been in isolation, and also large learning delays for those kids. And so as of right now, the Seattle Public Schools is planning to go back. Another reason that, and the other surrounding public schools are planning to go back to in-person instruction this week, perhaps, I think it's tomorrow. And so we are assuming that the majority of kids who are school age will be back in school. We understand that, so the other part of that is that young children are still very much lower risk of contracting COVID, and even lower risk of spreading it if they do get COVID. So they tend to have very mild symptoms and not to spread disease as much. So we've seen very, very low rates of severe disease and death for COVID for all individuals under the age of 18. So fewer than 500 individuals under the age of 18 have died in the United States so far of COVID. And I come from a family where we lost, I lost my younger brother when he was a child due to a pediatric cancer. And so I know firsthand, a loss of any child is a horrible tragedy. And I understand people's fear and anxiety better than you can imagine, because I remember, the aftermath of that on my family, of just how anxious we were about anything that could happen to the children within our family for years. And it is really, really hard. But I want to reiterate that the decision that was made in terms of kids returning to school is based both upon the low risk to them and the high level of benefit for them. We do not want anybody bringing COVID home, period, full stop. So our goal is to get everyone trained in appropriate masking procedures and get a high level of vaccination to really, really make sure that we are not getting workplace-based transmission. So we will be having conversations with you guys in the coming weeks about what does that look like and what does that mean in terms of workplace practices. But really, that is what we are aiming for.
Thanks, Hillary. Several of the questions in the Google Doc and the chat involve commuting to campus and using public transportation, and the concern with the fact that on most public transportation, although it says that you're required to wear a mask, several of the riders are not adhering to that. So people are concerned with getting to campus and the impact that having to drive every day might have on them.
Yeah, and that's addressed. So there's, and unfortunately I don't have this with me here, but we'll put it in some updated messaging. There's a really nice blog from Public Health Seattle and King County about recommendations about masking and what types of masks to use under what circumstances. And while for the general workday, if you're fully vaccinated, at UW, if you have a tight-fitting, multi-layered cloth face covering, that's entirely acceptable for our masking policy. If you are in situations like riding on public transportation, where you are, or traveling through airports or gatherings that are large numbers of people, anything like that, the recommendation that is on the Public Health Seattle and King County site is that you wear a face mask that's actually been designed and tested, and they give specific examples of models of those that they recommend. Those are now commercially available because we no longer have, so it used to be at the beginning of the pandemic, they were reserving them just for healthcare workers. So these are things like the KN94 and the KN95. Those are now commercially available, and they also provide you with guidance in terms of how to avoid counterfeit ones as well. So we will make sure that we get that information out to people. But I would say that's a great example of a situation where I would recommend upping your game in terms of what kind of face covering you're wearing.
And Hillary, speaking about masks and having to wear them at work, will the school be providing individuals with masks?
Yeah, so ULI has, I always want to say gazillions, but I think it's about 1,000. Yeah, absolutely. I will find the link for the face mask blogs. So Elizar, don't cut off at the end of the webinar. Can you give me a chance when we finish to find the link to the blog so I can post it for folks? Sorry, so face coverings. We have at least 1,000 cloth face coverings that are imprinted with the SPH logo. I know Uli had handed those out to people who were coming in episodically, but we have them available for people as you start to come back. And thanks, Elizar. He also purchased a limited number of specialized ones, for instance, for people who have, this is more relevant to faculty probably, but if you have someone in your unit, for instance, who's hearing impaired and you need something, face covering that has visibility for your mouth, he has a limited number of those as well. And then we will stock at the reception desks at the entrance to our levels within HRC and ask the units that are out in other locations as well to stock at the reception desks disposable face coverings, so that as visitors come in, they will not only be reminded to mask up, but be given a face covering if they are not wearing one.
Okay. And we're approaching 11:30, but we're going to keep the webinar going just a bit longer. One of the questions from the Google Doc, and a reminder here in the Q&A, is about eating and drinking on campus. And I think that speaks to something you said earlier, that we're going to have some behavioral changes, and part of that would involve how we eat and drink on campus.
Yeah, so I had a really nice correspondence with Paul Ramsey, who, as you know, is the dean of the School of Medicine and has oversight for all of UW Medicine. And they have developed very specific guidance for their clinical faculty and staff about eating and drinking. And I suspect that our guidance will mirror that. So, you know, an example, I'm at home today, and so I am very happy to have my cup of tea with me. And I'm sitting here without a mask on, drinking my tea. That's something that I would not be doing if I were in the workplace. So taking your mask off, taking a sip and putting your mask back on is the protocol that they've been using at UW Medicine for when they're drinking, for instance. And eating, there's also encouraging people not to eat sitting at their desk if they're in a communal workspace, but rather to go to a well-ventilated area. We'll be clearly marking what those are. And in HRC, we're really lucky because we have some really great outdoor spaces. So Juanita noted that EH&S just provided guidance today on eating on campus. We'll provide some more details for you guys, though. I think it's helpful to actually talk about the specifics there. And Shiva and I have been talking about how we might push out some of that information in a more user-friendly format, as opposed to like an hour-long webinar. So we'll work on that and also getting you more details about that as well. But I would say do expect some changes from the way that things have been. I actually I'm trying to think of my tea break in the future of coming back in person as a wellness break, as opposed to just sitting at my desk for extended periods of time and not taking that break. So it may be that we all work into our schedules, really being intentional about scheduling in wellness breaks to take care of things like getting caffeinated and getting hydrated and eating.
Okay, I know that you spoke to this, but maybe in wrap up, if you could reiterate why we're not waiting to January 2022 to come back to the workplace, and people who are still feeling anxious about coming back to the workplace, are there any resources that could be available for them to help mitigate some of that anxiety?
Yeah.
I know on campus we have the UW Resiliency Lab, and there are some other resources that could be available to us as staff. I don't want people to walk away feeling like, well, we just got to come back and they don't care about us and I don't belong. They just want to get more work out of me, but you do belong. You are part of the faculty and the student landscape. It's important. And I know that we've been able to do our work away from campus, but really and truly, the more we can come together as the community that we are, the stronger we are and the better we have at beating the pandemic, I think.
Yeah. So yeah, the bottom line in terms of why are we coming back now and not waiting until October or January is that we have students arriving on campus in 2 weeks. And so we are transitioning back to, or maybe it's 3 weeks, but a week after we come back, the students start coming back. And so we are transitioning back so that we are ready, because the educational portion of our mission within the School of Public Health is a substantial part of our mission. And it is a substantial part of the campus's mission. So this is a campus-wide time for everybody to come back. I saw a note from someone saying IHME is not coming back. That is incorrect. So IHME is subject to university policies, just like the rest of us. Units are not allowed to unilaterally make a decision that they're going to come back at a later date. So they, like everyone else, have to fill out individual telework arrangements if they want to continue teleworking. They also are, to be honest, are not as student serving as we are. It's a really small portion of their part of their mission, whereas for us, it's a really major part of our mission within the school. So they are in a different situation where for them, it may make more sense to have more people remote more of the time during the fall than it does for us. So that is sort of the bottom line of why we were coming back when we were coming back.
Thank you. Revisiting the question about people not having on masks, there's a comment in the Q&A that, and I believe Jeff Harris or Joe Gallagher might be in the audience and they can speak to this, but someone is commenting that they were in an HS Pop meeting where it was suggested response to people not wearing masks and refusing to, when asked, was to call security, which is essentially calling the police on students.
Yeah, please don't do that. So, you know, we are a community. Even though we've been apart, I still consider us to be a close and warm community, and rebuilding that sense of closeness and warmness is going to be really important. Our students, our public health students, they get the importance of masking. They are also human and they're going to forget. People will forget. So I think, you know, the first thing to do if you see someone without a mask is just calmly and politely to remind them that we have an indoor masking mandate and that they need to put on a mask, and direct them to where there are masks available. In addition to the masks that we will have available, there are vending machines, for instance, in the T-wing on the 4th floor, right as you come across from main campus, where that little kiosk kind of thing is for coffee. And so you can direct students to that. You could direct them to the reception desk, hand them one. And then for instructors, we'll work with instructors on helping them build up the confidence, but instructors are used to dealing with, it's not every day, but every once in a while, a disruptive student. And given how stressed out people are, I think, all of us offering each other some grace and a sense of humanity of like, it's going to take a while for people to get used to the like, oh yeah, I need to put my mask on. I forget sometimes, right? So we'll work on that of like, what's the way that we as a community help each other to get on board with that, and also provide some guidance for if you do have someone who's disruptive. I really think those are going to be the exception, not the rule. What we're hearing from the other packed 12 schools who tend to be also in states where, not all of them, but many of them in states where they have good vaccinations and masking requirements, is that they're seeing really good compliance with masking requirements and really high rates of vaccination. So I'm optimistic that things are gonna, it's stressful. I get it. We're all exhausted, and it's a lot to think of like one more change. But what I'm hoping is that with this one change, and with taking this sort of graduated approach where for this quarter, it really is this hybrid, we're getting used to it. People are coming in a couple days a week, but not every day, that it gives us a chance to sort of get back used to being together and enjoying the benefits of being together with each other, and figure out some of the more complicated things, like how do we deal with meetings where some people are in person and some people are remote. Those are all, there will be challenges. It's going to be a challenging quarter. And I appreciate that all of you are, thinking proactively about, how are we going to work through this together? I also have incredible faith in our community and the people in our community, and that, we are made up of a community of really great human beings who care about each other. And I think that we will be able to create that not just safe environment, but environment that is healing for all of us and provides each other with the support we need as we move on through the pandemic and the sort of continuing phase of it. I did put in the chat the link to the blog from Public Health Seattle King County, their most recent one about masks. In case you find it helpful, that Public Health Insider is their sort of public facing blog, and there's a lot of good topics on there. This is just one recently that I found to be particularly helpful.
Great, thank you, Hillary. Just as a final kind of, this is probably directed to Uli. When is the Starbucks and HRC opening?
And more importantly, Uli, when are the bathrooms on every floor opening? So we don't have to go between different bathrooms. I mean, different floors to go to the bathroom.
Questions I cannot answer fully. I'm still trying to find the full opening date, but it relates to the fact that custodians are being rehired at this moment. And once that's up to a reasonable level, we'll start seeing reopenings. In terms of the Starbucks, I am hearing October. In other words, after classes start. But I don't know a specific date in October. And the only thing I've heard about the Starbucks is you won't be able to use the app to get, your coffee. You're going to have to go stand in line, which.
Yeah.
All right. Well, better than nothing.
Yeah. True.
Yeah.
Hillary, there was
bathrooms. Uli, Ben had sort of reassured me that he was hoping to have custodians in place by the time we have back to person on September 13th.
I believe that's true, but they're in the process of being hired, so I don't know.
Okay, fingers crossed.
Yep.
It looks like Megan has her hand up.
Hi, Hillary. There have been some comments requesting that we might have another time to come together with the staff to focus more directly on the Google Docs, since there's lots of comments and questions.
Yeah, I'm happy
Is
to
that
do
something we could arrange?
Yeah, absolutely.
Yeah, I was about to mention that as well, and to also ask the question, if maybe with working with the communications team, we might craft a kind of response to what we have. I've been copying and pasting the Q&A questions into a separate document, so maybe we can take a first pass. Some of it, while I appreciate that there's a lot of emotional response to the prompting questions that we gave to individuals, I think if we look a little deeper behind some of the statements, that there's some inaccurate information that people are operating off of that we may be able to correct in whether it's a video recording or another session like this.
There is also, Anna Mari and Mark Richards, the provost, are, I think, releasing a communication for all faculty and staff that's supposed to go out, I believe today, that's addressing many of the issues that we were talking about today. But I have to say, like, so yes, I hear you, Joshana. I'm perfectly happy to do a written document. I think part of the reason that we wanted to have this session was that what we were hearing from people was that the written communications often felt very sort of official and like we're just perfunctory answering questions, as opposed to sort of talking about the values that the decisions are based on, which was what we were trying to get at today. But I understand that there's just a lot there. So happy to do another session, happy to do more written communications, whatever people feel will be helpful. And I also fully understand that some of the answers that I give are not going to be the answers that people were hoping to hear. So understand that, like, that sometimes I fully understand that people are concerned, stressed out, exhausted, anxious and scared. That is normal. We are all in this sort of post-traumatic or continuing traumatic stress period. And so I do not in any way want to diminish what people are feeling. That is a normal response to truly horrible circumstances that we find ourselves in right now. And I guess I want to reassure all of you that, if the Seattle Public Schools close down, the University of Washington will not, if all of the kids go home, obviously we will not continue to have people coming into work. We understand that people are going to have to take time off that for quarantining with kids who are having to quarantine, who have been exposed in schools. We are going to be flexible with all that. We understand that, and we will continue to work with you and your supervisors to make sure that we work through all that. So yeah, I think, again, I do feel like we have some advantages and benefits to accrue from coming back together in person. We're going to try and do it slowly, and appreciate all of you guys weighing in and continuing to communicate openly with us.
Great. Thank you.
Thanks so much for Joshana for moderating today. Really appreciate it. Thanks, Ruki, for your calm breathing, and everyone else. Thanks to everyone else who showed up and participated.